everyone, today our group gonna present about PUD, which is peptic ulcer disease. So peptic ulcer disease primarily involves duodenum ulcer and has been a significant global health concern for over 2 centuries. Associated with high mobility and mortality, it was once thought to be mainly driven by acid stomach acid, but it's now known to be a largely infection often linked to Helicobacter pylori. Now let's move to the background. So historically, PUD was linked to a stress and spicy food. It's more like people who love spicy food and stress, they are more prone to get PUD. But current research highlights H. pylori infection and NSAIDs used as the primary causes. It mainly affects older adults like in their elderly with their 70s or 60s age with multiple health conditions and tends to recur due to lifestyle factors and medication use despite advance in treatment. Because normally elderly normally will take a lot of medication because they are old, so they also will more to get PUD. Thank you.
Next, I'll be talking about the stomach and duodenum structure. The stomach is a J-shaped muscular organ located in the upper left abdomen. It has regions like the cardia, fundus, body, and pylorus. The duodenum is the first part of the small intestine, a C-shaped tube where much of digestion begins after the stomach.
Hello, I'm Wani. I'm gonna explain about protective mucosal barriers. The mucosal barrier works like security system for your body. First, mucus traps germs and helps remove them. Then, tight junctions keep the cells sealed so only safe things can pass through. And finally, your body keeps making new cells to stay healthy and protected.
So guys, now I'm going to explain about pathophysiology of peptic ulcer disease. Peptic ulcer disease occurs when there is a breakdown in this protective barrier, allowing acid and pepsin to damage the lining stomach. This leads to inflammation and eventually ulcer formation, especially in the presence of H. pylori and NSAID use. So that's it. Now we're moving on to factor of peptic ulcer. For the first factor of peptic ulcer include Helicobacter pylori infection and NSAID use, increased gastric acid and stress in critically ill patients. So this disrupts the mucosal barrier and increase the acid exposure. So now there are factors that don't cause peptic ulcer but can worsen it. Some factors don't directly cause ulcer but can aggravate symptoms or delay healing. This includes smoking, alcohol, spicy food, stress, and certain beverages like coffee. Thank you.
Okay, now let's talk about the symptom of peptic ulcer disease. So the first one is bloating and belching. This usually happens after meals and often with excess of gas. The second one is severe abdominal pain. Patients usually feel pain feel sudden sharp pain at their abdominal. This also makes signal as a medical emergency. It's called as perforation. The third one is GI bleeding sign, also known as hematemesis and melena. So as for hematemesis, is vomiting blood, and the color of the blood is usually in red color or coffee brown. As for melena, it's a tarry stool from digestive black, it's in color of black. So there's also clinical example for GI bleeding sign, which is a patient with fatty and black stool was diagnosed with a bleeding gastric ulcer. Epigastric pain, also known as burning or gnawing sensation. This usually happens across between a meal or after meal, and it usually happens during night. There's an example for this epigastric pain. The example is a patient reports burning pain for 2 or 3 hours after eating, they improve with food or antacids. The fifth one is loss of appetite and weight loss. PUD patient normally will go through a significant unintentional weight loss because they avoid eating, because when they eat they will feel pain in their stomach. That's why they have extreme weight loss, which make them look so weak and very sick. The sixth one is the last one, which is nausea and vomiting. This is may cause from resulting from irritating from stomach lining, and several cases shows that patient may vomit contain blood, which is also called as hematitis. So that's all for the symptom of peptic ulcer.
For diagnosis peptic ulcer, if you have signs of peptic ulcers, doctors can check in a few ways. The first one, with an endoscopy. A small tube with a camera is put into your digestive system to look for ulcers in your stomach. Secondly, they might check for H. pylori bacteria. This is done using a breath test, stool test, or blood test. The last one, doctors can use imaging tests, X-rays, or CT scan to spot bigger ulcer in the stomach. These tests help doctors know what's going on so they can treat in the right way.
Next, I'll be moving on to treatment for peptic ulcer. We have two types of treatment, which are drug and non-drug. For the drug treatment includes PPIs like omeprazole to reduce acid, antibiotics for H. pylori eradication, antacids for symptom relief, and H2 receptor blockers as alternatives. In some cases, bismuth compounds are added. Okay, so now let's talk about non-drug treatment for peptic ulcer. Non-drug measures involve avoiding NSAIDs, smoking cessation, limiting alcohol, reducing stress, and avoiding trigger foods. These lifestyle changes support healing and prevent recurrence.
So everyone, in summary, peptic ulcer disease results from an imbalance between aggressive factors like acid and protective mucosal defenses. With proper diagnosis, medication, and lifestyle changes, ulcer can heal and complication can be avoided. Thank you.